Welcome back to another deep dive. Today, we're going to be tackling a topic that many listeners have requested, hyperthyroidism. So all the kind of wild ways that your thyroid can go into overdrive.
Yeah,
We've
it
got,
can be quite a journey for the
it
thyroid.
really can. And you've sent me some pretty dense medical textbook excerpts. So it seems like you're after a clearer understanding of how this whole thing actually works.
Exactly.
Okay, so the source material jumps right into how doctors actually categorize this condition.
Mm-hmm.
And it seems like it all comes down to how the thyroid is behaving.
Yeah.
And a key test that they use is something called the radioiodine uptake.
Yeah.
What is that?
So imagine giving your thyroid a tiny bit of radioactive iodine,
Okay.
which is harmless in these small amounts.
Right.
The radioiodine uptake test measures how much of that iodine your thyroid absorbs.
Okay.
A high uptake means your thyroid is really grabbing that iodine to make new hormones.
All right.
But if the uptake is low, it means your thyroid's being sneaky, either releasing stored hormone or getting it from somewhere else.
Sneaky thyroids.
Yeah.
Okay, I'm intrigued. So that gives us two main paths to explore then. High uptake and low uptake.
Precisely. Let's start with the high uptake, where the thyroid is the main culprit, churning out those hormones.
Right. High uptake, hyperthyroidism. The source material mentions Graves' disease, which I've heard of.
Right.
But then there are some names that sound like they're straight out of a medical mystery novel.
Let's start with the usual suspect, Graves' disease.
Okay.
So it's the most common cause of hyperthyroidism, and it's an autoimmune disorder.
Okay.
Now, in Graves' disease, your immune system gets a bit confused and starts producing antibodies that act like go-go-go signals to your thyroid.
Okay.
It's like those antibodies are constantly hitting the gas pedal on your thyroid,
Yeah.
making it pump out way too much hormone.
So it's like your own body is attacking your thyroid and telling it to work overtime.
Exactly. And what's even more interesting is that research suggests that stress and even high iodine intake might increase your risk of developing Graves' disease.
Wait a minute. I thought iodine was actually good for the thyroid.
Yeah.
Like, isn't it an iodized salt?
It is. Iodine is essential for thyroid hormone production.
Right.
But like with many things in life, too much of a good thing can be a problem.
Okay.
It's a delicate balance. And it seems like excessive iodine might tip the scales for some people, potentially triggering or worsening Graves' disease.
So it's like a reminder that even like seemingly simple things like salt can have these complex effects on our bodies.
Absolutely.
Okay, what about some of those less familiar names that you mentioned?
Yeah.
Hashitoxicosis sounds pretty intense.
Oh, hashitoxicosis is a wild one. Imagine a plot twist in a medical drama.
Okay.
It starts with hyperthyroidism,
Okay.
but it can actually swing towards hypothyroidism later on.
Really?
That's because it's linked to Hashimoto's thyroiditis, which involves inflammation and damage to the thyroid.
Whoa. Okay, that's a roller coaster ride for your thyroid.
It is.
So in the beginning, you get the hyper symptoms from all this hormone being released.
Yeah.
But then the inflammation kicks in and things can slow way down.
Exactly. It's like the thyroid is saying, all right, I'm out of here after all of that inflammation.
Okay, that name is definitely going to stick in my brain.
Yeah.
Hashimoto plus thyrotoxicosis.
Right.
What about those toxic adenomas and goiters?
Yeah.
Those don't sound very friendly.
They might sound alarming, but they basically involve groups of overactive thyroid cells that have gone rogue.
Okay.
Imagine a bunch of cells in your thyroid saying, we're not listening to the boss anymore. We're going to make all the hormone we want.
Uh-huh.
And what's fascinating is that scientists have even pinpointed specific gene mutations
Oh, wow.
in these cases, highlighting just how complex this all is.
So it's not just about the thyroid itself, but also what's happening at the genetic level.
Exactly.
Within those cells.
Yeah,
That's pretty mind-blowing.
it is. And that's just scratching the surface of the high uptake causes.
Okay.
We haven't even touched on those tumors that can mimic hormones.
Whoa, wait. Tumors that mimic hormones.
Yeah.
Now that's what I call a medical mystery. Tell me more about that.
Well, you see, some tumors, and these can affect both men and women, can produce a hormone that mimics TSH,
Okay.
which is thyroid-stimulating hormone. It's like a hormonal imposter.
Oh, wow.
TSH is usually sent from your pituitary gland to tell the thyroid how much hormone to make.
Okay.
But these sneaky tumors take over that role and crank up the thyroid's production, leading to hyperthyroidism.
So these tumors essentially hijack the communication system.
Yeah.
And they send out these false signals.
Yes.
That's incredible.
Yeah.
Are those the tumors that the source material was calling trophoblastic diseases and germ cell tumors?
Yes, those are two examples. And then there's another rare one called TSH-mediated hyperthyroidism,
Okay.
where your pituitary gland, which is supposed to be the boss, goes a bit haywire and
Right.
produces too much TSH. It's like the boss is yelling, more hormones, even though your body's already swimming in them.
It's like having a boss who just keeps demanding more, even when you're already working overtime.
Exactly.
So we've got rogue thyroid cells, we've got hormone-mimicking tumors,
Yes.
we've got overzealous pituitary glands. It seems like our body can malfunction in so many unexpected ways.
Exactly. And to add to that, there are even cases where medications can contribute to hyperthyroidism.
Really?
The source material mentions a drug called epoprostenol, which is used for pulmonary hypertension.
Yeah.
That has recently been linked to hyperthyroidism in a few cases.
So it's not always a straightforward case of the thyroid itself being the problem.
Right.
It can be this whole web of interconnected factors.
Yeah.
It's a good reminder that medical knowledge is always evolving.
Absolutely.
We're constantly learning new things.
Yes.
Are you ready to dive into that low uptake world
Yeah.
where the thyroid isn't actually the primary hormone producer?
Let's do it.
Okay, bring it on. I'm ready to explore those sneaky thyroid scenarios where the hormone is coming from somewhere else. What are we looking at in this category?
Okay, so now remember those sneaky thyroids we were talking about, the ones that have a low uptake of iodine?
Oh, yeah, the ones where the thyroid isn't actually making all that extra hormone itself, right?
Yeah.
It's getting it from somewhere else or releasing stored up supplies.
Exactly. And this is where things get even more interesting because it really highlights how important it is to understand the cause of hyperthyroidism, not just the symptoms.
Okay, so let's pretend I'm a doctor for a minute.
Yeah.
How do I even begin to figure out what's causing someone's hyperthyroidism? It seems like there's so many possibilities.
It does seem overwhelming, doesn't it?
Yeah.
But doctors are kind of like detectives when it comes to diagnosing thyroid issues.
Okay.
They start by gathering clues.
Okay.
A thorough medical history, a physical exam, and blood tests to check those thyroid hormone levels.
So basic detective work, checking for those telltale signs.
Right. And then comes the game changer. The radioiodine uptake test we discussed earlier,
Right.
that helps distinguish between high and low uptake,
Okay.
narrowing down the possibilities significantly. It's like finding a crucial piece of evidence at a crime scene.
Ooh, I like that analogy. It's like we're piecing together a puzzle, and that test gives us a big chunk of the picture.
Exactly. And depending on what the initial clues and the uptake test reveal, doctors might order additional tests like thyroid antibody tests, ultrasounds, or even biopsies.
Right.
It's a step-by-step process of elimination and confirmation.
So they're gathering more and more evidence to pinpoint the culprit. I'm starting to see why it's so important to have a doctor who's really knowledgeable about all these different possibilities.
Absolutely. You want someone who can connect the dots, understand the nuances, and tailor the treatment plan based on your unique situation. Because once you know the cause, you can start treating it effectively.
Okay, so let's say we've cracked the case, and we know the cause of someone's hyperthyroidism. How does that actually translate into treatment? Are there specific treatments for each type?
There are. Let's go back to Graves' disease for a moment.
Okay.
If that's the culprit, doctors often prescribe anti-thyroid medications.
Okay.
These medications work by blocking the production of thyroid hormone,
Okay.
kind of like putting a temporary stop to that overactive factory.
So it's like telling those overzealous thyroid cells to take a chill pill.
Exactly. But those medications wouldn't be helpful for something like thyroiditis,
Okay.
which was one of the low uptake causes we were about to explore.
Right. With thyroiditis, the thyroid's just dumping its stored hormone. It's not actually making more.
Exactly.
So blocking production wouldn't do much good, would it?
You got it. In thyroiditis, the inflammation is the main issue, causing the thyroid to release its stores all at once.
Right.
So treatment often focuses on managing the symptoms like a rapid heartbeat
Okay.
with medications called beta blockers. And then usually the inflammation subsides on its own and things go back to normal.
So it's more about riding out the storm and letting the inflammation run its course.
Exactly. It's a different approach.
Yeah.
But it's all based on understanding the underlying cause.
This really highlights how crucial it is to have a doctor who can connect the dots and figure out what's really going on.
Absolutely.
It's not a one-size-fits-all situation at all.
I couldn't agree more. And it's empowering for patients to understand the different causes as well.
Right.
So they can ask informed questions and be active participants in their own care.
Right. Knowledge is power, especially when it comes to your health. So we've talked about Graves' disease and thyroiditis, which seem to be some of the more common causes.
Yeah.
But what about those less common ones, like those hormone-mimicking tumors we talked about earlier?
Right.
What are the treatment options for those?
Well, for those cases like trophoblastic diseases, or certain germ cell tumors, the focus shifts to treating the underlying tumor itself.
Okay.
This might involve surgery, chemotherapy, or radiation therapy, depending on the specific type and location of the tumor.
So it's not just about managing the hyperthyroidism, it's about tackling the root cause, which in those cases is the tumor itself.
Exactly. It's like treating the source of the problem, not just the symptoms.
Yeah.
And then there's rare cases where the pituitary gland is producing too much TSH.
Oh, right. The overzealous boss situation.
Yes. What do they do about that?
Exactly.
Well, those cases can be tricky, and treatment often involves medications to block the effects of the excess TSH, or even surgery to remove the part of the pituitary gland causing the problem.
Wow. So it's like a delicate balancing act, trying to get that hormonal communication back on track.
It is, and then there are those cases where it's not the thyroid or the pituitary gland, but something else entirely, like a medication that's causing the hyperthyroidism.
The source material mentioned that drug epoprostenol,
Yeah.
which can sometimes trigger hyperthyroidism.
Exactly. And in those cases, it's often a matter of identifying and eliminating the source. So for someone taking epoprostenol, it might mean adjusting the dosage or switching to a different medication.
It's like playing detective again, trying to track down the culprit and remove it from the equation.
It is. And this brings us to another fascinating category of low uptake hyperthyroidism. Exogenous hyperthyroidism.
Exogenous, what does that mean?
That simply means getting thyroid hormone from outside the body.
Okay, so how does that happen? Are we talking about like accidentally swallowing someone else's thyroid medication?
That could be one scenario.
Yeah.
But more often it's something like accidentally taking too much of your own medication. Or even intentionally taking more than prescribed.
So it's a reminder to always be careful with medications and follow your doctor's instructions.
Absolutely. And speaking of things being in the wrong place, let's talk about the most bizarre cause of low uptake hyperthyroidism. Ectopic hyperthyroidism.
Ectopic, that sounds like something out of a sci-fi movie.
It does, doesn't it?
What does that even mean?
It basically means thyroid tissue has gone rogue and set up shop somewhere it shouldn't be. The most striking example is struma ovari.
Struma ovari. Okay, now that definitely sounds like something from a medical mystery novel.
It does, doesn't it?
Yeah.
Imagine an ovarian tumor that actually contains thyroid tissue.
What?
And because it's thyroid tissue,
wow,
it can produce thyroid hormone leading to hyperthyroidism.
Well, so you can have thyroid tissue growing in your ovary?
Yeah.
That's mind-blowing. How is that even possible?
It is pretty wild. It's a rare condition, but it highlights how complex and unpredictable our bodies can be.
Yeah.
And sometimes during fetal development, cells can migrate to the wrong location.
Right.
So in the case of struma ovari, it's thought that some thyroid cells ended up in the ovary and formed a tumor.
Wow. That's incredible. So we've got tumors in the wrong place, accidental overdoses, and the thyroid playing hide and seek with its hormone stores.
Yeah.
It's like a whole secret world of thyroid shenanigans.
It is. And the craziest part, even with all these wild and different causes, it all comes back to the thyroid hormone itself and how it affects our bodies.
Right. Whether the thyroid is being tricked into making too much, or it's releasing its stash all at once, or there's thyroid tissue growing in some random place. It all boils down to an excess of thyroid hormone wreaking havoc.
Exactly. It's like different roads leading to the same destination.
Yeah.
And understanding those different roads, those different pauses, is what allows doctors to personalize treatment and help people get their thyroids back on track.
This has been a wild ride. We've gone from basic blood tests to rogue thyroid cells to tumors growing in the wrong places. I feel like I've learned so much already.
Me too. But we're not done yet.
Oh, no.
In the final part of our deep dive, we're going to explore the cutting-edge research that's revolutionizing how we think about and treat hyperthyroidism.
Okay, I'm ready. Bring on the future of thyroid treatment. Welcome back. I am so ready to have my mind blown by the future of hyperthyroidism treatment. We've uncovered so much already.
Yeah.
From sneaky low uptake scenarios to hormone mimicking tumors. It's like a medical thriller.
It has been quite a journey, hasn't it?
It really has.
But you're right. This last part is where we get to explore the really exciting stuff, the cutting edge research that's changing the game for how we diagnose, treat, and even prevent hyperthyroidism.
So we've talked about all the different causes, the detective work of diagnosis, and how treatment really depends on getting to the root of the problem.
Right.
where do we go from here?
Well,
What does the future hold?
imagine a world where we can treat hyperthyroidism.
Okay.
Not just by managing symptoms or blocking hormone production, but by actually targeting the underlying causes at a molecular level.
Okay.
That's the direction we're headed in.
That sounds amazing. But how do we get there?
Remember how we talked about those specific gene mutations
Yeah.
linked to some types of hyperthyroidism?
Right.
Scientists are now using that knowledge to develop gene therapies
Okay.
that could potentially correct those defects.
Oh, wow.
It's like editing the genetic code to fix the problem at its source.
Whoa, gene therapy for hyperthyroidism.
Yes.
That's incredible. So instead of just managing the overproduction of hormones, we might actually be able to reprogram those rogue cells.
Exactly. And it's not just gene therapy.
Okay.
Researchers are also exploring new ways to modulate the immune system,
Okay.
especially for autoimmune-related hyperthyroidism like Graves' disease.
Uh-huh.
Imagine being able to retrain the immune system so it stops attacking the thyroid.
That's mind-blowing. It seems like we're moving away from those one-size-fits-all approaches and towards treatments that are truly personalized to the individual and their specific type of hyperthyroidism.
Precisely. And technology is playing a huge role in this shift.
Okay. How so?
Think about wearable devices that can constantly monitor thyroid hormone levels,
Oh, wow.
giving doctors real-time data and patients more control over their health.
Yeah. So instead of relying on blood tests every few months, you could potentially have a device that's constantly tracking your thyroid, alerting you and your doctor to any fluctuations.
Right.
That's amazing.
It is. And that's not all.
What else?
Artificial intelligence is also being used to analyze huge amounts of data.
Okay.
Genetic information, medical histories, lifestyle factors to identify patterns and predict how individuals might respond to different treatments.
So it's like having a personalized hyperthyroidism prediction tool.
Exactly.
That would be a game changer for so many people.
It would. And all of this incredible research, these amazing breakthroughs, they're not just happening in some distant future. They're happening now.
Wow.
Some of these advancements are already being tested in clinical trials.
That's so exciting.
It is.
Yeah.
And it's only a matter of time before they become more widely available.
It really feels like we're on the cusp of a revolution in hyperthyroidism treatment.
We are. And it's not just about new drugs and fancy technology. It's also about empowering patients to be active participants in their own health journey.
That's such a good point. So for our listener out there who's been on this deep dive with us today, what can they do today to be proactive about their own thyroid health?
First and foremost, be informed.
Okay.
Learn about the symptoms of hyperthyroidism, things like rapid heartbeat, weight loss, difficulty sleeping, and increased sweating.
Right.
And if you notice any of these symptoms, don't hesitate to talk to your doctor.
Right.
Early detection is key.
And don't be afraid to ask questions.
Absolutely.
You have the right to understand what's going on in your own body.
Yes.
And to be an active participant in your own care.
Couldn't agree more.
This deep dive has been an incredible journey.
It has.
We've covered so much ground.
We have.
From the basic mechanisms of hyperthyroidism to the mind-blowing research that's shaping the future of treatment.
I know.
I hope our listener feels empowered and excited about the possibilities.
I hope so too, because while we've learned a lot today, the field of thyroid research is constantly evolving.
Right.
There's always more to discover, more to understand.
Right.
So stay curious, stay informed, and most importantly, stay engaged in your healthcare journey.
What a fantastic note to end on. This has been an amazing deep dive. Thanks for joining us.